Hi, how are you? My name is Carla. I'll be your baby's nurse for today.
Hi, Carla.
Hi. Can I have your baby's name and date of birth, please?
This is Carter Williams. He was born on September 14, 2020.
Oh, hi Carter. So cute. I love that name. All right. I'm just gonna look at his chest while he's quiet with you. Checking the respiratory. Okay. So the respiratory rate looks like it's at 32 breaths per minute. Okay, it's normal between 30 and 35 breaths per minute. Next, I'm going to just listen to his apical pulse for 1 minute, okay?
Okay.
Okay, so I listened to his apical pulse for 1 minute and it's 100. And I also heard no adventitious heart sounds. The rate and rhythm are normal. Alright, so that's a good sign. Usually babies have a slight murmur, so that's normal as well. I'm listening to his heart sound, his lung sounds now, okay?
Okay.
Okay, I just listened to his heart, his lung sounds for 1 minute, and his lung sounds are clear, no adventitious sounds. Alright, so that's great. I'm going to just look at his head for a minute. Okay, so his head is symmetrical and the shape is round. His posterior fontanelle is closed. The anterior fontanelle is open still, which is normal. That usually closes between 12 and 18 months.
Okay.
So the fontanelle feels flat and soft. I'm gonna just palpate his head. Okay, I don't feel any nodes, so that's a good sign. He's not sick or anything. I'm gonna just look into his eyes with my pen light. Alright. Right eye, left eye. Okay, eyes are clear and white. Alright, next I'm going to look into his ears. So I'm gonna pull down and back. Okay, down and back. Okay, both ears are pearly gray, which is normal. That's a good sign. Next, I'm gonna just check his pulse, right? So his radial pulse is 120, which is normal. The range is usually 70 to 150. All right. Now I'm going to check his capillary refill. All right. His capillary refill is less than 2 seconds, so he has a great blood flow. I'm gonna check his palmar grasp now. Okay, great. So the palmar grasp is there. Next, I'm going to listen to his belly. Okay, just put him on this surface for me. Great. All right. Okay, so his bowel sounds are active in all 4 quadrants. Next, I'm going to just check his head circumference.
Okay.
Alright. Okay, and his head circumference is 17 inches. Alright, I'm gonna check his length next. Alright, and the length is 26.5 inches, which is normal as well.
Okay.
Alright, and I'm gonna check his weight now, okay?
Okay.
Alright, I've placed him on the scale, and his weight is 16 pounds. So it usually doubles by this age. So at birth it was 8 pounds.
Yeah.
Great. So he's on the right track. All right. Next, I'm going to just inspect his genitals. All right. Genitals are normal. I don't see any wounds or any foul play. I'm gonna abduct his hip. The hips are normal. Bending his feet feels normal. The legs are equal in length. And I don't see any difference in one leg versus the other. Both legs are symmetrical bilaterally. Okay, next I'm going to check his plantar grasp. And his plantar grasp is present, which is a good sign. I'm going to check his capillary refill. Okay, capillary refill is less than 2 seconds, so that's perfect. I'm going to check his pedal pulse as well. Okay. Pedal pulse is also 120, same as the radial pulse. Alright, so now Is he able to roll back and forth from back to front, front to back?
Yes.
Okay, great. He's sitting up without any support?
Yeah.
Great. And is he babbling, making, playful sounds?
Yes.
Great. All right, that's awesome. Is he able to recognize, like, his name?
Yes.
Perfect. All right. Next. So just make sure that you don't feed him any honey, milk, or anything else. Other than that, he looks pretty good. And thank you for coming in today. I'm just going to hand it right back to you.
Okay.
Thank you.
Thank you so much.